name is Tammy Smith, and I am a registered nurse with Pinnacle Health. Could I see by a show of hands how many of you have thought about your career goals after high school? Awesome. Great. Glad to see. Alrighty. And of those who've thought about your career, have any of you considered a career in the healthcare field as a nurse? Yay! Good. We need nurses. Alrighty. So as you can tell, as you've probably guessed, I am here to talk to you about a career in nursing. First, I'm going to get started with a little about what nursing is. Nursing is a culture of compassion, empathy, and caring. As an RN, our knowledge is built from our formal nursing education and our clinical practice in many disciplines, which helps us provide and facilitate and provide care for our patients. Our mission is to provide all patients with care and dignity. We hold ourselves accountable for all care provided to our patients, and we have the ability to work autonomously based on our professional knowledge with our clinical practice experience. RNs work with patients of all ages, promoting physical, mental, and social well-being. RNs work with healthy individuals and families, educating them in the community on wellness and disease prevention. Our work is done in hospitals, medical offices, the military, home health care agencies, that's including hospice, school nurses, public home health offices as well, working out in the community like I discussed with wellness prevention disease programs, and those are just to name a few. Career opportunities available to nurses. There are endless opportunities, and again, just a few that I touch on here. There are so much more that you can do within the nursing field. First, which is kind of something of what I do, is like post-surgical care. I'm a staff floor nurse, and I work on a post-surgical unit providing care to patients after they've had some form of surgery. There's the med-surg units, which they care for the patients who come in who are acutely ill and get them, provide care to help them safely return to home. There's critical care, which is the ICU, you probably know it more as, to provide care to the critically ill patient. There's emergency care, care that's provided to patients who come in with emergent situations. That's a very fast-paced environment. There's also labor and delivery, the birthing of babies and taking care of mom and baby. That sounds like a lot of fun, huh, ladies? Pediatrics. For those of you who love children, you get to work with kids every single day, if that's something that you would find interesting. The NICU, that is care that is provided for those babies who are critically ill after birth. And that takes a special kind of individual to work with that kind of population. Geriatrics provides care to the elderly, which is near and dear to my heart. Neurology works with neuro patients, patients who have had a stroke, have had brain injury. Oncology, care provided for cancer patients receiving chemo and radiation therapy. And there's the operating room. Lots of nurses enjoy the operating room. That's where you get to work with the surgeons that are, of course, doing surgery in the OR. And of course, as I said, like the community outreach type programs. There are also, what I'd like to talk to you about is what can you do now to start planning for your future. It's as a nurse. You really want to think about that now. You want to make sure that you're taking lots of science and math classes and do well in them, because it will prepare you in your college courses for the nursing program. And students who do well in the science and maths will do excellent in the nursing program. You want to talk to your guidance counselor, and you want to make sure that you're on the correct academic program. Classes that are, that you're taking classes that are college prep. You want to talk to your parents. You want to talk to any mentors, role models that you may have. And with those science classes that I talked about, those biology, chemistry, the math, the algebra, you want to do really well in those classes. I can't emphasize that enough. So hopefully I have given you a, a little caption on, what it is that, nurses do and what it is that you can do to get yourself, on the right plan as a freshman in high school, to make sure you're taking those correct classes to prepare you for nursing school after high school. Thank you.